All right, now let's talk about your health care. President Trump says he will plan to sign an executive order on health care probably next week. It would allow people to buy health insurance from out of state. Several states already tried these out-of-state sales and failed. Now, critics say selling insurance across state lines is challenging for insurance companies. President Trump also promised to try repealing Obamacare again early next year. He says he thinks Republicans have enough votes and says he would negotiate with Democrats. Now, there's a few things Colorado senators would like to see to help stabilize the insurance markets. Democrat Michael Bennet spoke on the Senate floor about the impact on Colorado. He talked about how people who get health insurance on the individual market are unable to afford these rising premiums. In Colorado, regulators approved a 27% increase next year.
Let's get this short-term thing done. Let's stabilize the individual market, which we need to do. And then let's address health care in a bipartisan way, and I'll accept President Trump's goals for what it should look like.
And Senator Cory Gardner has joined other Republicans in supporting the Health Care Tax Relief Act. That plan would delay the health insurance tax that insurance companies pay for 1 year, with the goal of encouraging those companies not to raise premiums. Now, all of these changes and proposed changes in health care are certainly enough to make your head spin. Nicole Brady sat down with the CEO of Connect for Health Colorado to see what they are telling customers.
Joining me here in the studio now is Kevin Patterson from Connect for Health Colorado. And of course, this is the week that we saw pretty much the last effort this year to repeal and replace the Affordable Care Act. That died. So what does Colorado need to know right now about health care going into this coming season? When you sign up on the insurance exchange, how will Coloradans be affected?
So our first message is to make sure people understand we're still here.
Okay.
We're here to help them through the open enrollment period. And so for us, it's business as usual. We have seen, rates increase, 27% average increase across the individual market, 7% on the small business side. And so we think there's even more reason now with those rate increases. The tax credit also goes up. So they really do need to make sure that they continue to come in, shop, look for the financial assistance that's available.
So the Affordable Care Act stays the law of the land for now, but there are some changes, of course, with the premium increases and things like that. What are some of the changes that people can expect to see?
Well, for us, more things have actually stayed the same than changed. We have, again, we at least have one carrier for every county in Colorado. Okay. We're seeing good competition along the Front Range, so that helps. And we just want to make sure people understand that sometimes they underestimate what they're eligible for. And so for a person, a single person, that can make up to $48,000 and still be eligible for the tax credit. And for a family of four, it's $98,000 that they can make. And so we just encourage people to make sure they talk to the free in-person assistance, whether it's a broker, health coverage guide, a certified application center. There's a lot of assistance out there to make sure people get through and get the right policy for themselves and their family. Yeah,
and getting all the credits that are possibly available to you, definitely, all the money on the table. And this is all doable through the website?
Yes. We have a website, connectforhealthcolorado.com. We also have an 800 number. We have a call center that can help people. We'll be staffed up and ready to go for that. Our open enrollment period starts November 1st, goes through January 12th. That way they at least can get a January start date.
Well, looking ahead, past January, as we go into next year, and potentially this will come up again in Congress, Republicans saying they will bring back an effort to repeal and replace the Affordable Care Act once again. What are you guys looking at when you look at what could happen?
Well, for us, again, I think you said it really well. It's still the law of the land. And so what I tell my staff and what I tell our customers is, we are the federal program we're implementing at a state level. And we think we've done that in a pretty effective way. We've been able to show a surplus as a nonprofit. We're not a state agency, but we're actually being pretty efficient with our spend and looking at our revenue coming in. And so we've got a strategic plan. We're focused on making sure we're there for our customers, and that's what we will intend to do.
Is there anything that Colorado specifically could do? We certainly see the candidates for governor next year talking about this, and they did have some different ideas. Anything you'd like to see our state do?
Yeah, I think, we passed a bipartisan approach to create our state exchange. I think we know at the state level we're closer to our customers. You know, I talk to a lot of our stakeholders constantly. You know, we think a state-based approach does make a lot of sense. And so we just want to make sure that we have the flexibility at the state level to do the things that we're hearing from our customer base, from our carriers, from consumer advocates that we think balance this issue and gets the right kind of health literacy out there as well.
All right. Well, we may see more of it in the hands of the states, certainly. So Kevin Patterson from Colorado, Connect for Health, thank you so much for being here. And yes, a reminder, November 1st is when that open enrollment starts. When we come back, and we'll talk about the upcoming special session.